So in my practice, every day I was faced with obstacles of getting my patients the care that they needed, and this was primarily in the form of electronic paperwork that needed to be completed for the private insurance companies. Not only would it take, and it got worse as time went on. Wasn't so bad when I first started practicing, much worse when I quit practicing. It would take up to 25% of my time with patients, away from patients, to do that electronic paperwork. It would cost me $80,000 a year to hire enough staff to do the paperwork. And when the authorizations came through, and very few of them were denied, each authorization at the bottom of the authorization said, "While we approve this service, it does not guarantee we will pay for it." So one of the impacts of our private insurance system in this country is the impact it has on healthcare professionals. In all situations that I had to deal with an insurance company, I never dealt with someone who knew more about medicine than myself. And it was somewhat demeaning to have to explain my rationale to someone on the other end of the phone who had actually never even dealt with a patient. All they deal with is check boxes. So this was a very frustrating, time-wasting, expensive way of administering healthcare to individuals by dealing with all of these private insurances. And every insurance is different. And within each insurance, they have a dozen or 20 different policies, and each policy is different. And I think that is why at the bottom of every authorization, even though they approved it, they said it doesn't guarantee we will pay for it, because they weren't even sure when they approved it whether or not that person's policy would pay for it.